I was excited to get vaccinated primarily to help raise kind of public trust of getting the vaccine.
As more Louisiana residents get vaccinated for COVID-19, more misconceptions surface online. But more workers at Baton Rouge General aim to bust the myths.
First question, will I get COVID from the vaccine?
No.
Will I grow another thumb?
No.
Do I still need to wear a mask?
Yes.
Does it alter my DNA?
No, but what it does do is it alters how your cell is going to be producing the antibody. So it does do something to you, but it's what all vaccines do. These does it in a little bit of a different way by using recombinant DNA or RNA, which then programs the cell to produce the antibody against the COVID virus. So when the virus is in your system, then you produce antibodies to kill the virus.
Perfect. Does it alter fertility, or can a pregnant woman get the vaccine?
A pregnant woman can get the vaccine and does not alter fertility. There are several women in the 25,000 who got the vaccine in the study who actually got pregnant after the vaccine was given.
Okay. Does the vaccine have a microchip inside?
No, it does not.
Was the vaccine rushed?
No. From a safety perspective, it was not rushed. From a production and from an investigative perspective, it was rushed. It was a gamble that the various manufacturers and the federal government took to make sure that we could get the vaccine as soon as possible.
Okay, and last question. All right, this is a myth. The reason the vaccine has to be stored in super cold freezers is because of preservatives, and they may contain stuff that are linked to diseases like autism.
Not true. The reason why it's stored at that temperature is that they found when they did the studies that when they stored it at super cold temperatures, the vaccine was more active. And so obviously that these studies to see what was the right temperature. So the Pfizer vaccine needs to be at minus 70 or minus 80. The Moderna vaccine needs to be just as a regular refrigerator temperature.
BRG operating room nurse Paul Dozat feels relieved after getting his vaccine.
Don't be scared. Thousands and thousands of people are getting the vaccine. Minimal side effects.
Side effects include sore arm and fatigue. Consultant Trey Nelson says it's common to worry, but he says don't let misinformation fool you.
I felt a little tired after the second shot, but that might have just been from a long week of work. I can say that we have had employees who, after they've gotten their second shot, have felt just a little down or had symptoms of sickness for a few hours afterwards, but for the most part, all of that kind of goes away after an 8 to 12 hour period, really.
And the vaccine's benefits will last far longer. Anam Siddiqui, BR Proud.